Hello, everyone. Welcome to NAMI Johnson County's regular Lunch and Learn. Today we have two special guests from Johnson County Public Health. I've got Jamie Gade, who is a Social Determinants of Health Coordinator at Johnson County Public Health. She coordinates Healthy JOCO, Johnson County's Community Health Assessment and Health Improvement Plan initiative, much of which we're going to learn about today. Lisa Parlato joins us as well. She's a chronic disease prevention specialist at Johnson County Public Health. She's part of the Healthy JOCO team, chairing the Mental Health Priority Committee and co-chairing the Housing Health Priority Committee. So welcome, Lisa and Jamie.
Hi, thank you so much for having us. I'll get us started, but like Joanna said, I'm Jamie Gade. I'm Social Determinants of Health Coordinator, and this is a newer role at Johnson County Public Health. I've been with the department since 2020, but recently took this role in December of last year, and so I'll explain a little bit of social determinants of health first, and then I'll pass it to Lisa for her to introduce herself as well. But if you're not familiar, the social determinants of health, we talk about them a lot in public health, but they are the non-medical factors that influence health. So they're really the conditions in which people are born, live, work, learn, play, which is also in our logo. So they include things like economic stability, education, healthcare access, social support as well, like neighborhood safety or community connection. So there's a lot of different parts of social determinants of health. So we try to encompass that too in our health improvement plan, which we'll talk about a little bit later on in the slide deck. But I'm going to hand it off to Lisa for her to say hi, and then I'll take things back.
Hi, thanks, Jamie. I'm Lisa Parlato. My title is Chronic Disease Prevention Specialist at Johnson County Public Health. And this is a role that's pretty new to the county as well, honestly. I've worked here for a little over 2 years now. And primarily my focus is also on community health assessment and health improvement planning, the CHA chip that I work with Jamie on. I also coordinate the Keys Dementia Prevention Program, and I usually have a few different things going on at once. So happy to be here. Thanks, Jamie.
Awesome. Thanks, Lisa. So today we will go through what Healthy JOCO is overall. You'll hear Healthy JOCO a lot, I feel like, throughout this presentation. We'll talk about our health assessment process, and then we'll go into our health priorities. We'll talk about the mental health priorities specifically too, and just different goals and objectives and strategies we have throughout that. And then Credible Mind, we'll touch on that as well. It's an exciting new feature we have as part of our health improvement plan. Thanks, Lisa. And then we'll talk about the community well-being and support survey that's going out, that's out right now, actually. So I'll just dive in. What is Healthy JOCO? So Healthy JOCO is really an initiative that focuses on the community health assessment and community health improvement plan that is owned by the health department, but is also driven through community members. And we have a core committee of partners that are involved through different organizations. And then we also have a lot of priority subcommittees members through different organizations, and also just community members too who are interested in those areas. So it's a very collaborative effort. We're always looking for new ways to involve the community in the process too. So we would love to hear from any of you as well if you're interested in getting more involved in the process. But basically, the community health assessment portion is determined by Iowa code, actually. Health departments have to complete a health assessment based on Iowa code under the Board of Health. And hospitals also have to do this as well for different requirements if they're a specific type of hospital. If they're a public hospital like the University of Iowa, they are not required to. So there's just kind of some different requirements there. Basically what the health assessment does is define community needs, resources, and strengths. And then the health improvement plan looks at everything that the health assessment found, and then you assign those priorities. So we focus on those priorities for the next 4 or 5 years. and we'll get to those priorities later, but we do have 4 for the county right now that we've identified, and I'll get into that process a little more in depth. But we do use a specific framework to do this work, so we make sure it's evidence-based. We use the mobilizing for action through planning and partnerships, and the goal is really to focus on building health equity in our community. The framework, this is just to say there are 3 phases in the framework. We won't go into depth on this, but I will talk a little bit more about the specific assessments we did in the last few years to get to where we are now. So I think this chart also shows that it's very cyclical as well. So we do an assessment every about 3 years. And then the health improvement plan is typically, change takes time. So typically we do about 5 years for the health improvement plan. So we do have a mission, vision, and value for our work that we do in Healthy Joko. This was set by our core committee in 2021, I believe. So our vision is for Healthy Joko strives for Johnson County to be a diverse community where all have the resources, access, opportunity to thrive in a resilient, safe, and inclusive community. We also strive to be a community where institutions, community members actively work together to deconstruct silos, address health inequities through partnerships, collaboration, and power sharing. A lot of our mission is also very closely related to the health department's mission, but we kind of have a little bit more of a focus on evaluating health. So we'll dive into our health assessment a little bit more. We completed the first part of our health assessment, which was our community partner assessment. We have had about 31 different community-based organizations or nonprofits involved in this partner assessment and outreach. And so we also, to have a representative sample, we kind of selected participants based on the work that they do in the community and different subpopulations that they serve. So we ended up, after reaching out to about 31 different orgs, had about 15 different one-on-one interviews with partners where we used a specific tool. And we asked them what kind of work that they are doing and focusing on now and areas that our work can align. We talked a little bit about data and then resources as well in that partner assessment. So from there, we really compiled all of that information and we created some type of, it was a qualitative analysis through that data set. And we do have all of our reports as well. I'll mention on our website at healthyjoko.com too. So you can dive into that specific report if you have the will to do that. And then we moved on next to our community status assessment. So it's possible that you might have seen this out as well. This was mostly an online survey, but we also had folks out with tablets, as you can see in the pictures, asking folks for their feedback too on the survey. And we also had flyers with QR codes, many different ways of getting the survey out. But we asked some typical questions too, like how many days of poor mental health, poor physical health, do you have a primary care provider, do you have health insurance? So all of those questions were asked in this survey. We had about 725 respondents to this survey as well. We are planning on doing another iteration since it's been about 3 years since the survey. We would like to get some updated data to see where we're at and if we can identify some trends and where we're headed. So that will be coming up in fall of 2025. So we're excited to launch this again. And then for the final assessment we completed was a community context assessment. So this really focused on talking with providers to ask about healthcare experiences. So we looked at different areas of healthcare. We looked at just general health, like primary care, mental health, dental health, and then we looked at maternal and reproductive health. And so we had a couple direct service providers involved, healthcare staff, community organizational leadership in these areas as well. And it was kind of the same thing with the partner assessment. We did a qualitative analysis to identify different themes that came up. And then we also took very specific recommendations from these experts really in these areas. So that is also a large report available on our website at healthyjoco.com as well. And then also part of that context assessment was a mapping component where we looked at different healthcare organizations and where they're located. So we looked at pharmacies, dental offices, we looked at hospitals and clinics to see where they're located in the county. And then we also launched a different survey to ask those clinics, do you have different languages available other than English for health education material? Do you have a wait list currently? What kind of insurance do you accept? So that was in 2023, beginning of 2023. And so it's been a little bit since then. So we would love to get this updated as well on our website. But yeah, like I've mentioned throughout, we have a website, so healthyjoco.com. You can go there to find some more information, also the map and everything I just referenced. And then we also do have a quarterly newsletter. So it's healthyjoco.substack.com. And we could follow up too with a link to that after this. But if you would like to subscribe, we typically release updates about every quarter. So there are some times when we have special edition newsletters. So look out for that as well if you are interested in subscribing. It is free to subscribe as well. So then following this assessment, we looked at prioritizing all of the issues that we found. So from all the data, we worked with partners to identify themes that came up often in the data. So in the data we collected and also just pulling secondary data too from census and other large data sets that include county level information. So from all of that information, we developed about 13 different issue profiles to dive deeper into these areas with data, as well as even anecdotal story information from folks that we had talked with. So we kind of made a story really out of it. And then through all of those issue profiles, we got together twice in 2 different meetings to do a very specific technique called nominal group technique with these groups of folks. And this is cross-sector collaboration in this group. And we asked folks what's missing and what stands out to you. And so everybody went around and talked about their perspective. And from that, we had them vote at the end for their top 4 priorities. And so we also did a community prioritization survey where we did the same thing. We asked the community to also narrow it down to top 4 priorities and do a ranking order for that. And so that's where we landed at today. We are at healthcare access, quality, and affordability is our first priority. Mental health is our second priority, with housing coming in third, and then food security as our 4th priority. All throughout each priority, we also noted that this was talked about each time, the need for health resources and health education and literacy to be embedded in each one of these priorities. So as far as community health resources, is just getting folks connected to resources. And this is really where social determinants of health come in to play. We want to make sure that folks in each of these areas are holistically being taken care of by either being referred to a service that will help them or a resource that will help them, or either navigating themselves on a directory that's updated. And then, of course, the health education and literacy, making sure things are translated into the language that they prefer, and also that things are easily understandable. So those are a focus throughout each priority. From here, we've developed our community health improvement plan. We have in the last year gotten together, as I mentioned prior, we have gotten together with a group of 4 groups of folks that are subject matter experts or community members that are interested in these areas, as well as other partners that we've been working with throughout this as well. And that's already partners who have already been doing this work for years too. We've tried to encompass this group so we could talk about these issues and figure out solutions. So the purpose is really to enhance the quality of life within our community by addressing those gaps and inequities. So we've looked at the data again in depth in these committees. We have done a lot of different discussions and almost root cause analysis as well, and trying to figure out what's actually the issue here, and what's an area for public health to work in to move the needle in these areas. So this plan has each priority has goals associated with the plan, about 3 goals at least per priority. And then we have our objectives and different strategies to meet that until 2028. So this plan is available on our website as well. It's pretty lengthy, but Lisa will go a little bit more into mental health today, and so you'll get a feel of how this plan is laid out and overall our plans for mental health specifically. But hopefully after this too, if you're interested in any of the other areas, you could dive into that, or I'm happy to always set up a meeting too and chat with people about what we're looking to do in these different areas. So with that, I think I leave it off to Lisa now.
Yeah, thanks, Jamie. So in each phase of our community assessment process, mental health just came up repeatedly, which is probably not a surprise to anyone on this call. The average number of poor mental health days that was reported in our status assessment, the survey portion of the health assessment, average number of poor mental health days reported was almost 7 per month, and almost 20% of our survey respondents experienced more than 14 days or 2 weeks of poor mental health out of the last 30 days. So this is definitely something that we wanted to focus on. Mental health care providers, leaders of community organizations, and community members all stated that mental health care services in Johnson County are just not currently meeting the needs of our population at the level we would like them to. And honestly, it's a hard issue to narrow down because mental and behavioral health care services and needs are so broad. So for example, when we talk to providers, we heard a lot about lack of inpatient beds, lack of youth crisis service availability. Those are really emphasized. And when available services aren't matching up with patients' needs, or when they can't navigate the system, it's really a disservice to both providers and patients, because people end up, for example, waiting in a hospital when that's not really the best place for them to go, but they can't really go anywhere else. And when we talk to folks from community orgs, lack of culturally appropriate care came up a lot as one of the most pressing issues, which also ties into the need to support our mental health workforce, especially keeping providers in Iowa who have different cultural backgrounds and experiences, or providers who don't just speak English. And for everyone we talk to, providers, patients, community members, access to care in general came up in every conversation, especially cost, and the fact that Medicaid does not cover enough when it comes to mental health care. And then when you add on top of that attitudes about mental health, stigma, worries about seeking out care in the first place, let alone navigating the system and knowing where to start, there are a lot of needs. And especially with this level of community prevention work being fairly new to the Johnson County Public Health in general, it just made it very clear, like Jamie's been emphasizing, we need to receive a lot of guidance and regularly check in and work with our community partners to make sure that our efforts and what we can do within the health department's scope are really aligning with what's going to be most helpful for our communities in Johnson County. It was also clear from the data that the stories we heard, that mental health is deeply interconnected with other issues too, like housing, economic stability, healthcare access. So it really kind of reaches across all priorities too, and collaborating within our own sphere and with external partners is super important for this. So once we identified mental health as a top priority, we brought together a group of community partners already doing work in this space to join our mental health priority committee. So right now we have representation on our committee from NAMI, Community and Family Resources, Community Crisis Services, the Problem Management Plus program, GuideLink, Iowa City Senior Center, the Domestic Violence Intervention Program. So I guess DVIP, RVAP, both now. Iowa City Community School District, Johnson County Health and Human Services, like within our own county with community violence prevention and the regional behavioral health services, and UIHC. So we're, the committee meets monthly, and the first couple of meetings were devoted to defining goals, objectives, and strategies, kind of outline the work that we want to do in this area. Since we keep meeting monthly, we're co-creating this framework and these health improvement initiatives. And we're also sharing community updates at every meeting. So trying to not only establish where we are starting, but also stay on the same page about where we're going as we as a health department continue supporting mental health initiatives in our communities. So we're really excited to continue growing this collaboration and keep planning new ways to bring people together to do this work too. And a recent example of that is our Whole Health Summit in February. It was actually a half-day event on Valentine's Day, and I was not able to be there, unfortunately, but it was a really cool event. I'm sure Jamie can back me up on this. And we brought people together from all 4 health priority areas. So healthcare access, mental health, housing, and food security. And it was a really cool event for that relationship building, coordinating with people doing work across all different sectors, and really kind of piecing together how everyone's individual work connects with the bigger picture. So for our mental health priority goals and objectives, we have 3 goals, with each goal broken down into objectives and then strategy or action items. So the first, as I said, the first couple of committee meetings were devoted to creating these goals. And our first goal is to improve mental health awareness and resource access among Johnson County community members. So our first activity for this goal was launching a community survey specifically to assess mental health resource navigation and mental health care needs among community members, and that's shown in objective 1.1. Beginning in January 2025. We will still have that survey open through May, and I'll talk about that more in a couple of upcoming slides too. And then our next objective 1.2 will really be based a lot on those survey results. And objective 1.3, our Credible Mind website, I will also talk about in a couple of slides, but that has been launched. The site is live, as is the survey. And I won't read through these word for word, but the strategy and action items along with each objective are really kind of brainstormed ideas between us and the committee of what can we do that's within the health department's scope that aligns with our goals for the committee. And we were kind of in a constant process of checking in with those strategy and action items, prioritizing what we want to work on at that given time, and kind of figuring out how we can best support work that is going on right now. So goal number 2 is reducing social barriers to accessing mental health care services and improving service delivery, emphasizing culturally appropriate care. This also, I think, really highlights along with the 4 priorities, the constant inclusion in each priority of focusing on community health resources, health education, and literacy too. So in our objectives, there's that emphasis on really emphasizing a culturally appropriate care again. So collaborating with the Johnson County community health workers. We currently have a community health worker coalition. And the healthcare access committee will also be kind of part of this collab in general to really look at how we can help connect folks to mental and physical health resources better and access healthcare as well as education, and really just make sort of those services and knowledge more accessible. So the other objectives go along with this, with promoting usage of low barrier language around mental health care and increasing availability of materials in additional languages, so Spanish, French, Arabic, Chinese, and Swahili as the prioritized languages. Our third goal is to strengthen and improve connections and systems of support at the provider and the community level. And I think goal 3 especially highlights that this is, as I think we called it, a living document where the goals, objectives, and strategies give us structure to work within. But as we're doing this work and new opportunities or ideas come up where we can help out with different things that fit into our scope and our kind of vision for the committee, there's definitely room to adjust the plan for those too. So one example for supporting existing systems of support, if that makes sense, is that I and the mental health co-chair, my coworker Giselle, have started attending Johnson County System of Care meetings. And we have started helping with taking meeting notes and coordinating the hybrid logistics for those Zoom or Teams for those meetings too. So it's just little things we can do to support existing organizations and meetings and efforts that are already going on, because I think one strength we have is a lot of human power to really contribute to efforts that are ongoing. But also in general for this goal, our objectives relate to collaborating with Johnson County Social Services to update our resource guide and resource map, which will be an ongoing project for probably the next couple of years, and continuing to advocate for community mental health support services. Also promoting the usage of social needs screening and referrals, which ties into also supporting community health workers too. So there's a lot of connecting ideas with this plan. And I think really what we're trying to focus on is what we can do within like the scope and skill set and funding constraints of the public health department that aligns best with community needs and ongoing efforts. So one way that we are expanding mental health care access in sort of a preventive way is through our Credible Mind website, which you can access at healthyjoco.crediblemindcom or scan the QR code on this slide. And if you haven't checked it out, I really recommend it. I've used it personally, and this is really for everyone. So we launched the website in October 2024, and we were the second county in Iowa to launch a Credible Mind website, which is exciting. Wapello was the first county. So this is a free self-guided online platform that supports you in exploring and improving your mental health and well-being. So it has quizzes you can take to check in on your mental health or kind of make sense of certain symptoms you might be having. And it has a learning lab with research-backed articles, videos, podcasts. It's really built so that you can choose what you want to focus on and walk through it at your own pace. And with our partnership, we also get to customize some sections of this website. So we have a list of local resources with links that'll take you right to their website as well. So it's kind of serving a little bit as at least a very basic resource guide in itself too. When I explain this to people, I hear a lot of like, this is kind of a better version of Dr. Google. Like if you're experiencing discomfort, or you want to know what's going on, but you're not ready to talk to someone yet, instead of just Googling it, you can go to this website and access resources that are evidence-based and designed to walk through them yourself. So yes, I found the site really helpful, and what we're really trying to focus on now is promoting Credible Mind. So collaborating with our community partners, with our committee, with mental health care providers, asking folks to share through their networks. We're setting up tabling events at community partner sites, and kind of combining promotion of Credible Mind with the survey that we have going on right now too. And we get to access the analytics of not any like personal information, but just number of people using the website, what resources are being accessed. So we can kind of see how well our promotion efforts are working and get some insight into what community needs might be based on what people are using the website for. So since we launched Credible Mind back in October, we've seen a little over 2,500 site visitors so far, with the majority of those who reported their age in the adolescent to young adult range. 68% of site users reported their gender as female, 27% male, and 5% non-binary or another gender. And we are, like I said, integrating Credible Mind promotion into our public health efforts and encouraging community partners to share it, with one focus being on school districts and university students. So it's great to see that we are reaching young people. So that's cool to see. You can also see spikes in site traffic at the bottom in the beginning when we launched it, and again around the holiday season. We actually did a social media push with Greater Iowa City to promote the site to help with holiday stress. Folks using the site have also taken almost 900 assessments. So the most common assessment by far is, are your off days a sign of depression? And then are your worry days a sign of anxiety? So I think that makes sense, and speaks to how common depression and anxiety symptoms are. And hopefully these assessment results are a helpful starting point in, identifying, at what point is it appropriate to seek help, or just giving a little bit of clarity, direction, and honestly validation. So we can also see which links in the community resource list folks are clicking on the most frequently, with Abbey Community Mental Health Center at the top, Community Crisis Services, GuideLink, and Naloxone, Iowa being at the top. So as we keep tracking this data, we can stay informed about community needs and respond to any changes and trends that we see, and share that with our committee as well. So the other initiative that we're working on right now is our community well-being and support survey. So the survey asks, how are people taking care of their emotional well-being? Who are you turning to for help? Where are you reaching out? Who are you reaching out to? And what helps versus what gets in the way when you're trying to access support. So we're especially interested in understanding how stigma, costs, navigating services, or knowing where to start, and culture, or finding culturally appropriate care, play a role in whether or not someone feels comfortable reaching out. We also know that mainstream services don't always work for everyone, so we want to better understand what people actually need, where and how they're looking for support, and how we can fill those gaps, whether it's navigating the system, finding a provider that better meets their needs, or even in some cases recommending something like Credible Mind if people are dealing with really long wait times or aren't ready to reach out yet. So the survey is live now, and it will stay open through the end of May 2025. Right now, we're organizing outreach events to table at community partner sites, and even adapting the survey into more of an interview or focus group style of delivery. Really just trying to help tailor our approach in ways that are going to be best received across different communities, and really looking to our committee to help inform those, and working individually with community partners. totally get that not everyone wants to take a survey and not everyone is comfortable talking face to face about mental health either. So we really just want to meet folks where they're at. We're planning events at Community and Family Resources, GuideLink, Iowa City Senior Center, and actually we will have a table at the NAMI walk. So I and my coworker Giselle will be there, so you can meet us and say hi and take the survey and learn about Credible Mind if you see us there. So we'll use the findings of this survey to shape future efforts in our health improvement plan, both within our committee and even possibly across other health priorities like healthcare access too. The questions we're asking are really guided by our committee members. So mental health providers and community partners will use this information to help people access services too. So here is a general outline of our timeline. So our community health improvement plan spans from 2024 to 2028. And this is color coded by goal, and I won't read through every little flag, but the green flags are related to goal 1. So that is mainly the healthcare access or mental health care access survey, the community well-being and support survey. Collecting data, analyzing the data, sharing that with our partners, and then determining those follow-up steps. Goal 2 in blue is reducing social barriers to accessing mental health services and improving service delivery with that emphasis on culturally appropriate care. So a lot of those flags are related to collaborating with CHWs, which stands for community health workers, providing education, support, and really collaborating with Healthcare Access Committee on that as well. And then goal 3 in yellow is helping to strengthen connections and systems of support. So that involves spreading the word about Credible Mind, helping folks access care, even if it's preventive care in that way. Assisting with the resource directory launch, and yeah, I think that's the main thing right now. Also, just it's hard to put this on a flag, but just continuing to have ongoing conversations with our community partners and figure out what niche we can fill as we're doing this work. So lastly, if you would like to get involved, we would love to have more people take the community well-being and support survey. And I believe we can send out these slides afterwards, so you'll have access to the links and the resources we're sharing here. Please check out the Credible Mind website too. And if you want to help us spread the word, we'll have social media posts coming up soon. And also feel free to contact Jamie or myself. We have our contact information on the next slide too. If you want to sign up for our newsletter, we have a lot of ways to stay in the loop. Thank you so much for your time. We have our contact info here. Please feel free to reach out for any questions, collab opportunities, or if you have questions now, I'm happy to talk more. Thank you.
You guys have been busy.
Yeah, it's been great. We've really loved and have leaned on our community partner support too, because we know there's so many folks that are in these areas that have been working in these areas for years. So there's so much of that subject matter expert knowledge that we've been really trying to lean into as well.
Yeah, one of the questions I asked Mary was if we have that survey available to folks in our place.
Sure, absolutely.
I know there's some folks on the line who have direct experience with our challenges in Iowa. And, you know, I know Leslie Carpenter's on the line, and she works hard at the legislature to try to get things changed there to make things happen. But yeah, it takes all of us for sure.
Yeah, absolutely. I think that's another part of our coming from public health as well as just the advocacy piece too. And so that's something, you know, we haven't done as much of, and we would love to step more into that advocacy role too moving forward, especially as we do look at the bills coming through and how do we make them less bad with the information we have as a county and the stories we've already gotten from folks, and hear how they would be impacted by these bills.
Having spent the past 2 days trying to revive one of my bills, I would tell you that more voices over here at the Capitol, where I am right now, are always welcome. We need more people to be coming over here and speaking to it. So thank you for your work and thank you for gathering the information.
Thank you, Leslie.
Yeah,
You
that
do a lot of great advocacy work. I'm very impressed.
right. Data speaks loudly, as do individual stories, of course, but data really helps.
Yep, absolutely.
And
thank you, Leslie, for your work as well. I wanted to say that as well. Thank you for your work as well.
Anyone else have any questions? Wow, this was very informative. I had no idea the extent to which you have been working to try to gather all this information and the different points of contact, really, too, that you've got. I can't wait to check out that Credible Mind. You're going to send us that link? Yeah. I went out there and I saw just Credible Mind and looked at kind of the company itself that's helping put these together at the local levels. Was it an expensive venture for Johnson County?
We were lucky enough to be able to apply for I guess sort of a scholarship. They had an initiative where the National Association of City and County Health Officials, they called it Behavioral Health 360, where they teamed up with Credible Mind and we submitted an application so that we could have a discounted rate to launch it. Yeah, so that worked out really well for us, actually. And yeah, definitely looking for funding to keep that going. And I don't think I mentioned this in the presentation, to translate the site into more languages too. Right now, we have it in English and Spanish, but there's additional cost for each language. So we're looking to be able to, yeah, continue having the site at all, and then also translating the site into more languages too.
That's great. I know that I'm going to share this recording with my son-in-law, who's with the Iowa City Foreign Relations Council. So that'll be good.
Thank you. Yeah, that would be wonderful.
Yeah. There are a lot of mental health and stress challenges going on right now in that population.
Yeah, that's what we've been hearing as well. Or Lisa's also been hearing too, just in the mental health subcommittee, that we're trying to figure out ways to alleviate that a little bit of what we can do locally.
Right.
There are a lot of reasons to be stressed, unfortunately.
That's true. That's very true. Well, thank you.
Thank you.
Yeah, you bet.